about this sequence of heartburn in pregnancy because I'm suffering from heartburn or something.
Heartburn in pregnancy, you see, the food you swallow has to go from the mouth. It enters the esophagus, which is the food pipe, then entered into the stomach. Now, there's something about the stomach. The stomach contains acid. Now, this acid content of the stomach is very important. It's not because of that somebody will say he has hydrochloric ulcer. The acid itself is what? It's important. One, it kills some bacteria that comes with the food. It helps to mix with the food, and it has an antibacterial effect. Now, because this is the stomach itself has some protection against the acid. Now, number one is that the acid is not secreted as acid. It's hydrochloric acid. One part will secrete hydrogen, another side will secrete chlorine. So inside the stomach, they will now meet together and form hydrochloric acid. But the stomach itself has a protection that makes the acid not to haunt the stomach. But if the content of the stomach now leave the stomach and come up to the esophagus, which does not have a protection, you know, initially when it is in the stomach, first of all, one will come as hydrogen, one will come as chlorine before they will meet. So before they meet, they are not hydrochloric acid. It's after mixing they become hydrochloric acid. Now, what they do is that the stomach with protection, it has a wall protecting the acid from harming it. But when that content now leave the stomach and come to the esophagus, which does not have that protection, that is usually what gives the heartburn. And that is more likely in pregnancy because the womb has started growing up and is pushing all the organs up, including the stomach. So the treatment is number one, to increase bedtime from eating. So if you want to sleep by 9, for example, make sure that your last meal will be maybe 7 or 6. Give like 3 hours between the last meal and what? And bedtime. But so some women will eat by 9:30 and they will sleep by 9:35. You know now. So by the time you finish eating and I don't know if you understand, most of the food is still in the stomach. By the time you are sleeping, some of them will just sit back into the esophagus. Then another thing, if you see a normal person that is not pregnant, we talk about weight loss. But usually weight loss is not a factor in pregnancy. It is the gravid uterus that gives us that. Another thing is to reduce spicy food, reduce things that contain gas, mango Pepsi and all whatnot. Okay, but the major thing is that it is more likely physiological, as in the major treatment of that is lifestyle modification, not really going to take drug. There are some drugs for it. We can give proton pump inhibitor, antacid, they can help. But the primary number one treatment is lifestyle modification. It is only when we have done this lifestyle modification and it failed before we talk about drugs. And you are not even on the big side. Then there is gastroparesis. Some people, their stomach, the emptying time is increased. And when normally the food should leave the stomach after 3 or 4 hours. Some people, the food might stay there for 6 hours because they are still prone to vomiting. Anyway, there are some drugs that can be given to take care of that if it's no longer physiological.